That's happening among the really close contacts, the husband and wife, people who've shared cabins, etc. The initial patient, the initial case, and his wife, they joined the boat in Argentina. Our assumption is that they were infected off the ship.
Yeah, that isolation, this is a nightmare at sea. A cruise ship at the center of this deadly hantavirus outbreak. 3 people are dead, several others are sick, and today 3 of the sick passengers were evacuated. They're now on their way to the Netherlands to get more medical care. These are live pictures right now from the MV Hondius cruise ship. It's off the coast of Cape Verde. Roughly 140 people are still stuck on that ship. None of them have any symptoms. They're just waiting right now and worrying as the ship heads to Spain's Canary Islands. They'll then be examined once they get off the boat, treated, and eventually taken back to their countries. Here now, though, Dr. Omer Awan, senior public health contributor for Forbes. I mean, the worrying and the waiting has to be just agonizing for these people stuck on this ship. I mean, let's talk about hantavirus. What is it? Where does it come from, first of all?
Good morning, Marni. Well, hantavirus is really a family of viruses that can really result in serious illness. Most people get infected by exposure to rodents, either through their saliva, feces, or urine, but there's a rare strain that's called the Andes strain that can really spread person to person, and that may be the case in this case in the cruise ship. And that's concerning and problematic because that means more people can get infected. So certainly the risk to the public is very low still, but something to watch out for. 3 people have died. There have been 7 suspected cases. There may be more, who knows? There needs to be a lot more testing and a lot more work to be done before we can really understand the extent of what's going on here on this cruise ship.
I mean, doctor, you think of the close quarters of a cruise ship. People are sharing tight spaces, food buffets often. How is this Andes strain spread?
Well, usually the initial infection really still needs to have some exposure to a rodent. So probably the first infection occurred when someone had close contact to a mice or a rat. But after that, it can really be person to person. The virus is replicated through respiratory secretions, and that can result in person to person transmission when people are in close contact for an extended period of time. So a cruise ship would literally be a perfect environment for this virus to spread. Now, this virus doesn't spread as easily as other respiratory viruses like COVID or the flu, for example. So that's reassuring for the public and for the 150 or so people that are on this cruise ship. It's not as easy to get this infection, but with that said, it's possible. And certainly this is something to watch out for as this story evolves.
What about the incubation period? I mean, how long can people be sick or contagious once they have it?
So once you get infected, usually the incubation period is anywhere from 7 to 9 days to 39 days. So you can get infected and not show any symptoms for over a week. And then once you have symptoms, you can spread it to others. And then again, that incubation period starts again. And so a month can actually go by when you don't have symptoms, then you can start to have symptoms. So that's scary, right? For a lot of the people that are on the boat, they may feel that fine right now, but they can get infected, even 1 or 2 weeks later. Very important to watch this because, as you know, if people start to get symptoms and those symptoms go to the lungs, 1 in 3 of those can die from this. And that's what's scary and troubling. Again, 3 people have died, and we don't know what the overall impact of this is going to be.
Right. And scary for the people on the boat who worry and wonder if they have it. But then once they get off that boat, there's the concern that if they do, in fact, have it, but they're not showing symptoms yet, it spreads. So what is the most prudent approach to keep the general public safe once these people deboard?
Well, the most important thing is for these people to get medical care, to be evaluated by physicians, public health officials, because there's actually no treatment for this. There's no antiviral drug that can treat hantavirus. So that's why treatment is very supportive. So people who are having a cough, chest pain, difficulty breathing, it's important for them to go to the hospital and ensure that they have enough oxygen so that they're able to breathe properly. These are critical and these improve outcomes. So really important for people to understand that. The more testing there can be, the more care there is, the less likely people will die, obviously, and the less likely people will be able to spread it to other individuals. So that's the way to really contain this outbreak.
Yeah, you can't be careful enough before they disembark. All right, Dr. Omer Awan, thank you so much. Appreciate the time and expertise.